Hello, everyone. Uh, Today we are going to discuss about a topic regarding different routes how to enter into the medicine in Canada. So this route will be very typically for getting into as a medical doctor. There are many other routes which are paramedicals, like going into some ultrasound courses or likewise. But this presentation is purely for going into the medicine as an MD or as a working physician. So my name is Ahmed Wahi, and I am a resident in Northern Remote Program at University of Manitoba. So let's start. Okay, so I have divided into 5 routes. First of one is the Carms, which is Canadian Residency Med Services. Second one is MLP IMG program, which we will go into detail of that. Then there are the different provincial criterias having that practice ready assessment program. The fourth one is direct entry as a family physician, in which people they don't have to go for any of the training. The fifth one is the medical school, and we will go for one by one into each and see how they look like. First of all, Carms. I have also uploaded a video a few days ago regarding the detail about how to fill up the application, and there were some tips and tricks. So today, in this section, I will give you a brief regarding of that. So what the Carms is the residency med services. In fact, what that means is the Canadian graduates, they also go into the residency program through Carms, and we are competing along with them to enter into the residency program. IMGs have a specific quota for that, in which there are a number of seats which are allotted for Canadian graduates, and there are some of the seats which are allotted for the IMGs. There are 2 iterations for that. In first iteration, they are separated. But in the second iteration, sometimes in some of the universities, they unite all of these, not as a Canadian, and they don't, I would say, they don't mark them as a Canadian graduate, Canadian studies seats, and also IMG seats, and they mark them as one. Some of the universities like that of Quebec, they don't demarcarize into Canadian graduates and IMGs. They also make them as a one series. So they have mandatory requirements, some of which are down. Okay. Now it depends on the program to program, and it depends on university to university, but most of the universities, they have this requirements. First of all is the status. The person applying into the Carms, they should be at least permanent resident or Canadian citizen. The people who are like international student or they are on visitor visa, they are not eligible for that. Secondly, degree, of course, it should be recognized from a medical school. There should be specific exams which should be given off. One of them is MCCQE1 exam, and the second one is NAC exam. In the past, there was another exam which was called MCCQE2. This is no longer required. If some people have it, there are some of the universities, like for example, in Quebec, they can provide the QE2 scores along with as a substitute for the NAC exam, and they do accept it, but some of them. So go to the program descriptions wherever you want to apply and see if you don't have the NAC exam and you have QE2, whether you are eligible for that or no. Now there are behavioral exams. These one of them is BC CAP, okay, for British Columbia. Then there is an Alberta MMI exam, then Casper exam, FM Pro C. So these are all what these exams are. They see as a behavior of the candidate, how they are well established personality, and their personality is whether adjustable to the Canadian medical system or not. So if I will go the one which is Casper, second last one. So this is purely a non-medical exam. They will give the situations in this exams which are purely on a non-medical basis. Maybe you are sitting in a bar, or maybe you are sitting in or you are a one candidate in an exam, or you are making a presentation or something, and there will be some issues. And they will ask the questions, and then we would have to answer them. FM Pro C, they give examples of typically which are related to the medicine. Like for example, there's an issue came up, you are standing in a ward, and how a person should be behaving with that. Alberta MMI and BC CAP, they are MMI, both of them are mini mental station exam in which they give different scenarios and we have to record our response in front of the camera in case of Alberta and also in front of examiner in the case of BC. Then there's an English requirement. Every province have their own English requirement. Some of the provinces, for example, Saskatchewan, they don't accept anything except the English. If we have been an IMG and there are not the specific countries which are allocated into their list. Okay, there are some of the provinces, like for example, Ontario and Manitoba, they can accept a letter stating that this candidate has studies of medical school in English, and they have some of the practice with the patients in English. So I would say go into the province criteria and see what English requirements are, but somehow we need to show the English requirements. Okay. Alberta and Quebec. So they are the two different provinces. They have their own requirements. For example, in Alberta, we need to be the resident of Alberta whatsoever. Okay, they do not take application from any non-Alberta resident, and somehow in Alberta, Ontario, or other province, they do accept it. Even in Quebec, they do accept it too, but not in Alberta. Now, in Quebec, what is the specialty of it? There is a specific French requirements. These are unique to the Quebec, and also we need to send the program directors and the application and status. And also there is a one whole performer that they have to fill up. I'm not aware into the detail of that, but if you are a French settler or you know the French English language, Quebec is a one of the stream in which you can go for that. You would have to show your competency into for their province. Okay. Next, mandatory requirements are, of course, references. They need to be 3 references. Then there are the transcripts. Transcripts, they are actually transferred from physicianapply.ca. Then MSPR, the MSPR has a choice. If you have the MSPR, you can upload it by yourself into the Carms website, or otherwise the college can send directly to the Carms website. Personal letter and a CV, they are very important. I will make a video separately for that, and I will upload it how to make the personal letter and CV. Now, there are some of the programs they want to submit the medical degree to. Whatsoever medical degree to enter into the system to start the application medical degree would be started from physicianapply.ca. So if they ask you, you can submit that. Okay. Some provinces, they want World Directory of Medical School Records, which is FAMER. For example, Manitoba, I know for sure they do want it. So you will submit it. Pictures is never a mandatory thing. Okay. But I think Quebec want the mandatory one as a picture, but other provinces, they always state that it's up to your choice. They never share the picture with the programs before the interview. They always want the programs to do the interview and after submit their scores, and then they make the picture share. This is for only for remembering, oh, what kind of who that person was, whose interview they have taken. So it's just a memory aid which they use the picture of. Otherwise, before interviews, they never share the picture of the person. Then there is a self-identification questionnaire. This is not mandatory. Most of the universities, they want it, and I did submit it at my time. I would say go ahead, do it. It's not going to create any difference into your application. Okay, it's just their own research thing, what they are looking at, and how much they are just collecting their own data for that. Okay. Now, there are some of the points which I will share with everyone that which is actually in the mind of many candidates. What are the things actually which will help us to increase the chances into getting into the Carms? Okay. The main thing is, one of the main point is, if you are a fresh graduate, that you have a huge chances of getting into the system. The many of the programs, they have specifically written it. If you are a fresh graduate within 5 years or 10 years of studies, you have it, you will be given preference. Now, many of the provinces, they have also written it. If you have the residency of practice or you have post graduation, uh, within that specific period of time, 5 to 10 years, you will also be given preference along with fresh graduates. Now, somehow MSc and PhD, I know for sure they have the specific marks in a file review process. So people who have MSc or PhD, they also are given specific more points for that. It does not mean that if you are not going to get into the system, let's go with MSc and PhD, because it's a long commitment. It is MSc. I came to Canada as a student, and I was a student of MSc, so I had to complete it whatsoever. And later on, I thought whether to go to a PhD or no, but it was again a very long commitment. So I decided to not pursue for that, but let's go with the Carms, and that's how I am in the system right now. So do the risk and benefit ratio, okay, and then take the decision. Now, research has a very big role. Okay. Somehow I have seen IMGs, if they just get some of the experience, not a lot of experience, like they just work as a volunteer, and it's not necessary that you will have a lot of research publications or something like that. It is just like you have spent some time in research, so they know that, okay, so there is something which you know about the research. You did file reviews and retrograde studies or something like that. They will give you the enough points for that. So it's not like you have to really submit or indulge yourself into a very long kind of research. Until and unless some of the program descriptions, they do say that we would like to have the people who have a huge research. So if that is the case, sure, then it is definitely over there. If it's not mentioned, still just a little bit of experience will help you. Community work, every program community work is plays a lot of role into it. In fact, they like to call the people on interview who have the community work. And community work is not the work which is related to the medicine. They want to see what your life is without the medicine. They know from IMGs you did everything in your life to come into the system, and you want to work in medicine, you want to die in medicine, but they want to see that how a person you are outside of the medicine. So and that community work means you are working with the people, you are taking care of their problems, and how you are talking with them, how your communication skills are with them. So these are all the things. Now, the next thing is a leadership experience. Almost all of the provinces, this is your leadership skills. Many people ask this question, how I would be able to show it? The answer is community work. So I have seen people, what I tell to the people is at least volunteer yourself into the two areas. One would be the community work, and the second would be any role in which you would be having an experience of leadership experience. Okay. So that's how it should be showing off. Like, for example, any organization you're working up, you can actually be at that position as a vice president or president or a treasurer or something like that, which is on elite positions of those organizations. Okay. There are some provinces, for example, in the western part, where New Brunswick, sorry, not the New Brunswick, British Columbia, Saskatchewan, Manitoba, they play a lot of role into the indigenous communities. And in fact, I'm seeing now eastern provinces, they are also going into having the importance of having indigenous communities and experience with them. So I would say always have a voluntary experience or something like that, in which you would be able to explain this thing in your file, and also when in the interview that you have experience with indigenous communities. Now they are directly asking this question in the interview, somehow directly or indirectly. Like I would say directly in most of the interviews, that whether the candidate, as a candidate, you have the experience with the indigenous communities or no. Okay, so be prepared for these things. They will literally ask, if not directly, then indirectly, about the indigenous experience. So in familiarity with the Canadian healthcare system, that is also one of the main point which helps you to go into the system. The one of the best example is the clinical assistant work. Okay, observership is on a very last thing. Okay, clinic observership means you are doing nothing, you are just seeing the patient. You are just standing over there when your attending physician is actually taking histories and doing physical examination and observing that, and we are not actually allowed to talk or touch with the patient. Clinical assistant has a bigger role. It is the same role as a physician assistant, but there is a difference that we have a medical degree, so we can work as a clinical assistant. So now every province, for example, we are sitting in Ontario, then, and if you are, we are applying in the Ontario program, Ontario clinical assistant experience will have a huge importance. But it does not mean the clinical assistant experience of Ontario will be helpful in other provinces because they have the different laws and rules. For example, Ontario clinical assistant program is not recognized. What it means is they don't have to go through the license process. But in Manitoba and Alberta, there are very strict licensing rules for that. So that's why they don't accept any of the clinical assistant experience either from Ontario or if it is from any other province. So if you're applying in Manitoba and you are working as a clinical assistant in Manitoba, you will be on a higher edge of getting points for the file review process. Okay. Other than that, which is of a little bit less value, is paramedical or elite healthcare workers. If you are one of them, because I have seen many people coming into Canada and taking this degree and working as such in these fields. So definitely this is one of your positive point too, and you can explain that in your file and also your interview. That will be helpful for you to telling them that yes, you know about somehow about the Canadian medical system. Commitment to the field. If that is the one thing which I have noticed, if you're applying anything other than the family medicine, okay, they want to know that whether you are applying into this program not as a plan B, because many people what they do is they apply in internal medicine or psychiatry, and then later on they try to switch into the family medicine program, and they don't like it. So that's why they always try to make sure that this person who is applying over into our program, he is really or she is really committed to this program or no. What that means? That means is, for example, if we are applying in psychiatry, do we have the experience of psychiatry before that coming and applying into it? Like for example, if I would have a like a 1 year or 6 months or something like a rotations, or I have done some of the internships or externships or as an independent practice in psychiatry, definitely they know that, okay, so I want this field and I'm not applying in psychiatry as a plan B of entering into the system and then switching into family medicine. Similarly, there are other fields, ophthalmology, obstetrics, and all of that. Okay, so commitment to the field is shown via your previous experiences in that specific field in which you are applying. Okay, connections. If you ask me one thing which will be help you to get into the system, this is the connections. Okay, connection is the main bait of getting into this Carms and system. So what does a connection is? Go and talk with the doctors, work over there as a clinical assistant, work as an observers. Even many people feel that observership is not helpful. But no, observers, if you are working, you are making connections over there. Maybe you are not getting points of getting in as an observer, but you are showing them how keen you are of learning the things and how keen you are into getting into system and working as a physician. So then definitely if you show yourself as eligible person, they will definitely put you in consideration. Okay, along with that, with connections, if they are giving you a good person reference letter, of course it will help you a lot. Okay, now there is a mistake which many people do. That is a second last point thing which I'm going to explain. Submit what is asked. Okay, so if a program asks in the comms that these are the 5 ABCDEF documents that I want, submit only whatever they asked for. Do not over submit anything. Okay, this is the worst thing that a person will do. Okay, just 1 second. Okay, so this will be a worst thing a person will do of submitting many other documents. So I have seen people submitting their volunteer experience work, they have submitted whatever they have done, their certificates. If they have not asked it, you do not need to submit it. Only submit whatever that is asked for. Okay. Interview skills. Now, if you have very good connections, you have a very high scores in NAC exams, you have research, you have community work, your file is above the sky. This all things will be helpful to you for getting into system via getting a call for the interview, and that's it. Now your final step to get into the system is via interview. That is the only thing which will help you to go into the system. It's you and your people who are taking your interview. Okay. What I say to the people is, if your scores, your file application is very bad, but somehow you got, because of connection or some other reason, you got your interview. Okay. Now, if you have convinced those people sitting in front of you, whatever your previous history is, they will take you whatsoever. And now, if your scores is really high, absolutely awesome kind of connection you have, but you have messed up with the interview, they are not going to take you whatsoever. So interview is one of the main thing which is final and the main hurdle of getting into the system. So be prepared for the interview as the best as you can. And one advice that I will give you is be honest in the interview. I have seen people giving the interviews the all of the answers which they try to learn it and in a different ways. So there's a regular answers which every person answers. Please do not do that. Okay. So try to answer the things which is on your own personal experience. If they are asking you give experience of XYZ, do not give the experience which everybody gives. Give experience which is very typical of yours. So that's what it means be honest in your interview. Okay. Okay, so now we will discuss about the second, which is MLP IMG program. So what this MLP IMG program is. So what they say is, if you were a family physician in your back home, okay, great. Then come to our province, Manitoba, and we will see if you are eligible for that. Then we will give you 1 year training. That's what the basic concept of MLP IMG program is. And this is unique to Manitoba, and they trained you for 1 year. And this is parallel to the Carms people through residency, regular residency, R1 and R2 program. Their admissions, they go right away side by side every year. Okay. And their residency, their training of 1 year, they starts on exactly the same date when Carms residency training starts. Okay. So but the only difference is this is for 1 year, but the Carms training is for 2 years, and this is unique to the Manitoba, and none of any other province is actually offering this program. And this is 1 year program. There's a link for that, and I will also post all of the links into the video down into the chat section, and please make sure to go, feel free to go into that and read more about it. So how this MLP IMG program works, they offer, they ask you to fill up the application, and the good point is there is zero fees for that. It's totally free to submit the application. So there's no loss. So go ahead, submit it whenever their application opens in probably August, and their deadline is end of August or early September, something like that. And they call for the interview, and that interview is the initial interview. That is a first interview. They pick up out of many people, they pick up certain amount of the people for the second interview. And in second interview they call, then they get acceptance after second interview. So what happened in the second interview in Manitoba, they have 5 health regions, and every health region, they have their own representative, which are mostly the HR people over there in the interview. So there will be like around 8-10 people in the interview panel. One or two out of them could be medical doctors or physicians over there, MD physicians. The rest of them, they are all human resources individuals from each health region. So they, if they think, one of them think that you are good for their health region, they will accept you. Okay. So that's how the second interview looks like. It's different from the cons interview, but Just let's see if you are eligible for that or no. So what are the requirements? Along with the first line, medical degree, status in Canada, English, references, personal letter, a person should have both QE1 exam and NAC exam given before the time of the application. Other than that, the person should have at least a 1 year family medicine training, in which there should be 8 weeks or 2 months of medicine, surgery, peds, and OB-GYN. There is no, it's not mandatory to have an ER experience or psychiatry, but I would say they give preference for the people who have in ER too, because there are many regions in rural Manitoba in which they need the emergency physicians. Okay. Other than that, there is a 1 year of independent practice and lifetime that is needed. Okay. And regarding the recency of practice, recency should be of at least 1 year and last 5 years. Now, these 2 points, 1 year of independent practice and 1 year of they can be same too. Like if a person has done recency of independent practice of 2 years or 1 years and last 5 years, both of these points will be accepted or they will be checked off. Now, another scenario is, which is also unique of program in Manitoba, is they do accept clinical assistant experience as independent practice for MLP IMG program. Over here, the point to remember is MLP, this experience is unique to MLP IMG program only. The Carms applications, they do not take the clinical assessment as an independent practice, but MLP IMG program, they do take it. Now, if a person has worked for 1 year in any family medicine based environment, which can be in the hospital too, or it can be into the clinic too, they can take it as an independent practice or and recency of practice in the last 5 years. I know many people who were not working as a family physician environment in clinical assistant. They were working in some other areas like cardiology or orthopedics or psychiatry. They do not take those one as a recency of practice. Okay, so make sure it should be in a family medicine environment. Now I can see that many of the people, because of this program, they are immigrating from other provinces to the Manitoba, and it's a very unique program, which is only for the Manitoba only. Okay. Now they give, I think there's another slide which I was, second slide which I will go for that. Uh, Pointers which increases your chances of getting into MLP IMG program. One of the main thing is Manitoba. Why? Let me tell you. As I told you that this is 2 interview process. So for the first interview, they say it, the program director have clearly mentioned that if you are eligible for the MLP IMG program and you are a Manitoba resident, you will be getting a call for the first interview whatsoever. Okay, so that's the main thing. Like if your scores are just passing scores or it's just anything, and you are a Manitoba resident and you are eligible with all of the things, that you have a 1 year of training, you have a 1 year of recency, you have a 1 year of practice and lifetime, you will be getting called for the MLP IMG program whatsoever. Okay. Now, still, if you have a recency of practice, not as a clinical assistant experience is also a huge edge for MLP IMG program too. So it's not only for the Carms, but also for the MLP IMG program. And again, clinical assistant in Manitoba, not anywhere else. They do not count it as anything. They count it as nothing, I would say, if there is a clinical assistant experience in any other province other than Manitoba. And now there are some of the seats they call for the first interview, some people from outside of the Manitoba. So what they do is they just put a figure in their mind for the first interview. We are going to call 70 people for the interview, or 100 people, or 60 people, or 50 people. Okay. So how the system goes on is they will call all the Manitobans who are eligible for MLP IMG program. So whatever that number is, for example, out of 70, 40 people applied and they are going to give them call. Now the remaining number is 30. Okay. So out of that 70, now that 30 will be for the rest of the Canada. Okay. So similarly, if they have a picture of 60 people in their mind and 50 people have applied through Manitoba, they will be getting call, and now remaining seats are 10. So those 10 seats will be distributed through the rest of the Canada. Okay. Now, how they do see and they call the 10 people, for example, or the other X amount of people, is their file worth. How are their scores? How there are references? Um, how their personal statement is, how their experience is, and their experience in emergency, and all of that stuff. So they do. It's very, very competitive if you are not living in Manitoba, and it is very helpful for you if you are living in Manitoba. Okay. Now again, if you the next last thing is interview skills, as same as Manitoba. If you even you are a Manitoban and you have not given the interview good enough, they're not going to take you. Okay. So this is all of the things they are helpful for you for getting interview, and after that it's you in the interview and the people who are sitting in front of you. If you have convinced them, you are in. If not, you're out. Okay. Now, the practice ready assessment program. So up till now, we have seen two programs. One is a Carms, which is like around 2 years residency training, and MLP program, which is a 1 year residency training. This PRA program is not a training program. What they say is you are a family physician in your back home. Okay, come show how you are doing. If your practice is well enough with our standards, there you go. You have the license, start working. But they don't train you, and during that they have assessment of around 3 to 6 months. So they say it 3 months, and if they feel it, no, there are some of the areas you are missing, they may actually try to see you more, and which may extend it up to 6 months, not more than that. And still, if they feel that there is some trouble, they won't hire you, they won't give you. They pay you during the period when you are working, but they keep a very close eye on you. Now, this can be a family medicine, and they are for the specialties too. Every province have their own requirements, so this is province to province, it's not one province. So people, they have a huge difficulty of understanding this thing. I have compiled it into one presentation, and see if during this presentation, if you find out that you are eligible for one of these programs, go start working on that one. Okay. Now there's another exam which we have to give, which is very specific for PRA program. Okay. And that is a TDM exam. What TDM exam is, this is like the second part of QE1 exam, which is CDM, clinical decision making. This is almost like that, in which all of the exam is like CDMs, right? And in which they ask you about the medication, doses, differential diagnosis, and we have to type the answer in it. Okay. So normally what the process is, if you find out that you are eligible, you apply. Okay. And after apply, they see that in initial screening that you are eligible for it, they will give you a call for TDM exam. Otherwise, person cannot go and sit for the TDM right away. A person should get a call for TDM from the PRA program of that province. Okay. Then after getting that call, the person says TDM. If you clear that TDM, okay, then the province, they call for the interviews, and after the interview they feel that you are good, you go and they allow you to sit and give the assessment. And within 3 to 6 months, if the assessment is passed, you have the license. So that's what the process is. Okay. So it's a very good program if you are eligible for it. Okay. um let's go with the requirements. So I'm going to from starting from the west side. Okay, because I'm Manitoban, I'm living in the middle. So let's start with the west part. British Columbia, along with that, all degrees, Canada, status in Canada, English requirements. So what they require is they require QE1 exam. There's no need of NAC exam in this. Okay, so there is, and second one is TDM, of course. So every of the PRA program almost they require the TDM. Other than that, QE1 exam is required. In postgraduate training, they require of 2 years. Okay, and there are the specific stations that they require. Okay, or wards, I would say. In that 2 years, there should be at least 4 weeks or 1 month of in each of medicine, surgery, OB/GYN, ped, psychiatry, and ER, and there should be 2 months of family medicine in it. Okay, so these are the minimum. Now, please do not count yourself as an eligible person if any one of these are missing. They pay a very close attention to it. You would be missing you would be wasting your time if you are doing that. If you think that some of the rotations are missing in your training, you can always go back home and do that training once again. Okay, so they do not count as I would say, as it should not be as a continuity of that. It can be broken off too. I remember I was eligible for the PRA program too. How it was, because I did my 1 year of training after my degree MBBS, and after so many years of that, I went back home again and I did 1 year of family medicine training. So that became 2 years, and I became eligible for this program, for this 2 year postgraduate training. So you can do it at any point. You can break it into three months kind of training in like in your lifetime. Okay, so it should not be in the continuity. Now they want 2 years of independent practice at least in your lifetime, and out of that they want at least 24 weeks should be there in last 3 years, and in that 24 they say that there should be at least 960 hours completed. Now, it does not mean that if you can complete the 960 hours in 3 months, you are eligible for this point of recency. No, your recency should be 24 months or 6 months. And in that 6 months, there should be 960 hours. If you complete 960 hours in 8 months, then that will be the point when you will be eligible for Alberta. So that's a unique province. They require QE1 exam only, and afterwards TDM. So they do not need recency of practice. That's the main thing. Okay, they don't want you to have experience in a lifetime. They say it's fine. They don't want the recency of practice from you, but what they want from you is very strict, which they are of, is 2 years of postgraduate training, in which there should be 8 weeks of at least medicine, surgery, OB/GYN periods, and 4 months of family medicine. Now, many people, what they do is they have breakdown family medicine training 2 years. They don't accept it. They want it to be continuous non-stop of 24 months. Okay, now the next thing is, which is unique of that, a person should be have this training within 3 years of the application. Okay, if for somehow reason the person has been delayed for the application, then that's some time when they say that okay, now we want the license of practice. They want you to have an at least 1 year of independent practice in last 3 years. Okay, so let's say you have been delayed even 1 day or 4 years, then the mostly the people, they have to go back home and then they do 1 year of independent practice, and then they apply for that, or they can spend time in their further training too. It's up to you guys. Okay, Saskatchewan. In Saskatchewan, they call their program as a separate program. It's called SEPA. Okay, so SEPA program is also unique to Saskatchewan. They want QE1 exam. They want either of NAC exam or QE2. QE2 was there before pandemic of COVID. If you have given it, there you go. You don't need to give NAC exam. Again, TDM should be given after the file review. Now, what they want is they want 2 years of postgraduate training. They don't want any family medicine experience in it, but they say there should be 8 weeks of medicine, surgery, OB/GYN, peds, and psychiatry. They don't want ER experience somehow. Now, if you have training less than 2 years, then like for example, a person has done a training of 1 year, okay, then they say that give us 3 years of independent practice as a GP. Okay, so 1:3. So 1 year less, go 2 years less, then go for the 3 years of independent practice. Okay, so what does it mean is rather than 48 months of training, you have done 47 months of training. They are very strict. Then you need to show 3 years of independent practice. The last point would be recency of practice. They need 3 months of recency of practice in the last 3 years. That is definite. Okay. Manitoba has not opened their program for the last few years. So there was no point of going into detail of it when they are not opening it. And that makes sense. Why? Because they have their own program, which is PRA program. MLP IMG program, and it is more in a hype as compared to PRA. So they really like the MLP program. They want the people to train by their own hands and then start working into the community rather than relying on the people who does not have any training in Canadian system. So forget about the PRA program of Manitoba. Now, the next is of Ontario. This came up in 2023 recently. This is most fresh one. Okay. So their requirement is almost similar to the BC with a slight difference in it. Okay. Again, they want QE1. They want NAC exam, which is different from the BC. And they have the requirement of the specific scores, and these scores are depending on when a person has given a NAC exam. So the most they should have at least 608, or if it was a little bit before that, 1405 or superior performance when the people gave NAC exam during the pandemic, or before that it was 429 out of 500, and then out of 100 if you have given exam that would be 75. Now there should be 2 years of postgraduate training, same as that of BC. 4 weeks of medicine surgery, peds, gynae ops, psychiatry, and ER, and 8 weeks of family medicine training. Now, what they want is Ontario, which is different from BC, is they want 3 years of independent practice and they want it continuous. Same like Alberta was trying to ask for 2 years of continuous family medicine training. They want 3 years of continuous independent practice. Okay. And for residency, and this should be a lifetime. Okay. So if you are a graduate of 15 years ago and at some point in the practice in the life you had the 3 years of independent practice, there you go. This point is accepted. It's tick off. Now for the residency of practice, they want at least of 24 weeks or 960 hours, which is same of the BC in last 3 years. Okay. Next one is New Brunswick. Right now their applications are open, so if you think that you are eligible, then go ahead, apply. Their deadline is 31st of October, and all of these requirements should be there. Please make sure that, including English and all of that stuff. QE1 exam, Nakoski, they say it on the website that it preference is given, but it's not mandatory. Okay. Then the next is 2 years of postgraduate training and 1 year of independent practice. Okay, so they have a little bit difference. It is, if you have 2 years of postgraduate training, then they want 1 year of independent practice. Or if you have less than 2 years of graduate training, but at least 1 year of training, then they want 2 years of independent practice. So see if you are eligible out of these or no. And whatever the training is, if that is a 2 year postgraduate training or 1 year, they should have at least 4 weeks of rotations in each of medicine, surgery, peds, gynae, psychiatry, and ER, and 8 weeks in family medicine. Now they want 450 hours. That's what they have written. They have on the website, they have not written that time for that. They just want the 450 hours and last 3 years. But my assumption is it is like 3 months. Okay. Otherwise it would be very difficult to explain, like where you were completely lying and sitting months to months in the hospital or what. So my assumption is it should be 3 months, but let's see what they say. But they have not set any specific period. They just said 450 hours. Newfoundland and Labrador, what they want is they want MCC QE2 or NAC exam. They don't want QE1 exam. Good thing, right? And they also have a specific score requirement, which is exactly the same which was of before previous province. They want 2 years of postgraduate training. Somehow their website is very unique in a sense that they have not written so many things of that. Over there, they did not mention what kind of departments they are looking at to have at least experience. They have not written about the residency too. I would say that if you think, go ahead, apply, okay, and see whether they will tell you, they will let you know whether you are eligible for that or not, because their website is a little bit confusing, okay? And whatever information I was able to find is over here. The next one is Nova Scotia. They want QE1 exam. Okay. Technically, if we have a QE1 exam, we also have the LMCC. So QE1 exam. They don't need the NAC exam. It's not mentioned over there. So 2 years of postgraduate training and 1 year of independent practice, or 1 year of postgraduate training and 2 years of independent practice, the same that was of the previous province. And 8 weeks of medicine, surgery, peds, gynae, ops, psychiatry, and 8 weeks of family medicine. So this is a little bit different. So they want 8 weeks of each of them. Okay. Now residency again, 450 hours in the last 3 years. They have not mentioned in how many months it should be completed off. Okay. This is summary of the PRA program, which I have stimulated into a paragraph. Go ahead, take picture or something like that. So this is just, and it's not the detail. So don't rely on this paragraph only. Go into that slide if you feel you are eligible for it. There are some of the things which are in a little bit detail of that. Okay. um, Next one, direct entry as a family physician. I know many friends of mine and my colleagues who with whom I was studying, they were not able to get into the system. So what they did is they went to one of these. So most of them actually they went to United Kingdom, UK, because UK is relatively more easy to get into the system, um, but the payment space scales and all of that stuff is a little bit low over there, and their laws are a little bit difficult over there for a physician to survive. So most of the people from UK, they do their training and they come over here. And the good point is the UK training in family medicine, it is accepted as a training in Canada. Then people, they don't have to go into the any residency program, any MLP IMG program or something like that. They are directly, they can enter into the system. And similarly, what they have written on their website, it is the same rules for the people in Australia, Ireland, and United States of America. I heard that there are some other countries like New Zealand or somehow, and other provinces, but countries in which they might accept the degree. But think about which province you are intending to reside and practice, and try to get into the contact of their college, and see if your degree into that training into of your specific country is being acceptable or no. Okay. But it's a good program. So many people I've seen, they do go, they do it training, and they come back and the Canada, then they accept that. Okay. The last point, okay, so is medical school. There's a common saying, I would say, courage and the act of learning vanishes only with the death, or with the death only. So what does it mean is, what I'm trying to explain over here is, um, why not go into the medical school in Canada and try to apply it once again? The only thing is, what we have to do is go for the MCAT exam once again, right? Why I'm saying it, I know a couple of my friends who did this route and they were into the medical school. There is a one person which I know. I knew him closely. He in his back home, he was an engineer. He always wanted to become a doctor, but somehow he went into the engineer field. So he came here when he find out that he is not able to get into the engineering field easily. So he went to the high school and did specific courses, and university he did specific courses, and then he gave MCAT exam and he went into the medical school. Now he's practicing as a physician. So courage and act never dies. If you think that you want to go into this route, go ahead, go for that. Okay. So that's the end of my presentation. If you guys would have any questions, feel free to contact me, okay? Or you can put your any question in the chat room. There were so many links into this presentation. I will post all the links into the comment section. I want to wish best of luck to all of you. In summary, I would say that just think which program you're eligible to and try to apply into that. Let's take an example. Like if you are really an old graduate, okay, more than 10 years or 15 years or 17 years, and you don't have clinical experience, which is gone, Carms would be a the gooder option for you. It's not like that. It is the end of the world. You can still apply into the Carms. You can go for the residency practice and come back. If you are old graduate and you have a lot of experience, PRA program is the best for you. If you are Manitoba resident, MLP IMG program is the best option for you. Okay. Otherwise, if you think that things are not working in your angle, you can also always go into one of the countries whose training in family medicine is acceptable, and you can go and come back over here. So these are the things. Work hard, and do let me know if you guys have any questions. Best of luck. Bye.